Welcome back to The Explainer. If you've been tracking the recent news, you've probably seen those alarming headlines about hantavirus outbreaks popping up. But today, we're skipping the scary sound bites. We're going to systematically demystify this pathogen using strictly the science. We'll dig right into the data, the virology, and the clinical realities to understand exactly what we're dealing with.
We've got a clear roadmap for today's Explainer. 1. Meet the virus. 2. How it spreads. 3. Recognizing symptoms. 4. Diagnosis and treatment. 5. The global outbreak risk. And 6. Prevention and control. Let's get right into it.
Section 1. Meet the hantavirus. Let's take a look at its global footprint.
Now check out this fascinating geographic split. Hantaviruses are literally found worldwide, but they behave completely differently depending on what hemisphere you're in. The New World strains found in the Americas, think Andes and Sinombre viruses, primarily target the lungs and heart. But if we look at the Old World strains over in Europe and Asia, like Hantan or Pumala, their primary target is actually the kidneys. It's the exact same viral family, but they choose totally different battlegrounds inside the human body. Wild, right?
To put a formal name to the whole shebang, we're talking about zoonotic orthohantaviruses. This is a classic onehealth dynamic, which basically means human health is deeply tied to animal populations and our shared environment. The natural hosts here are rodents, specifically certain types of rats, mice, and voles. And here's the catch. The rodents carry this virus for their entire lives, shedding it in their droppings, urine, and saliva, but they never actually get sick from it. The human body, though, it reacts very, very differently when it encounters this pathogen.
Moving right along to Section 2, how the virus spreads, specifically how it jumps from a rodent to a human.
This sequence brilliantly illustrates the invisible nature of this threat. It is almost entirely airborne. An infected rodent leaves behind droppings or urine. Over time, that material completely dries out. Then, a human comes along. Maybe you're sweeping out a dusty shed, opening up a summer cabin, or working out in agriculture. That simple sweeping action kicks up the dust and actually aerosolizes the viral particles. You breathe it in, and boom, the infection begins. You don't even have to see or touch a rodent to get infected. You literally just have to breathe the dust they left behind.
All right, Section 3, recognizing the symptoms. Let's talk about those early warning signs. So, after inhaling the virus, the incubation period can actually be surprisingly long, taking anywhere from 1 to 8 weeks before symptoms even hit. And the crucial takeaway here is that those symptoms vary drastically depending on your geographic location. If you catch a New World strain in the Americas, it causes hantavirus pulmonary syndrome, or HPS. This is a rapidly progressing disease where the lungs literally fill with fluid, causing severe shortness of breath, and it comes with a staggering fatality rate of up to 50%. On the flip side, Old World strains cause hemorrhagic fever with renal syndrome, or HFRS. That one attacks the blood vessels and kidneys, potentially causing internal bleeding and kidney failure. It's still incredibly serious, but it does have a lower fatality rate, generally sitting between 1 and 15%. But here's what makes early detection notoriously tricky for doctors. Before the severe lung fluid or kidney failure even sets in, the initial symptoms for both syndromes look almost exactly like a really bad case of the flu. We're talking fever, chills, profound fatigue. A key hallmark to watch out for, though, is severe muscle aches, particularly in the large muscle groups, like your thighs, hips, and back. A lot of folks also experience gastrointestinal issues, nausea, vomiting, abdominal pain. It's just such a broad, common set of symptoms masking a much, much deadlier threat. Section 4. Diagnosis and treatment. Confirming the virus. Because those early signs mimic so many other common bugs, how do medical professionals actually confirm it?
Well, it all starts with a conversation. A careful patient history is absolutely essential here. If you come in with flu-like symptoms and casually mention that you recently cleaned out a dusty garage, went camping off the grid, or work in forestry, that is a massive red flag. That history prompts doctors to run highly specialized tests. They'll use serological testing to look for specific IgM and IgG antibodies your body is churning out to fight the virus, or they'll use an RT-PCR test to detect the actual viral RNA circulating right there in your blood.
Once that diagnosis is confirmed, patients and their families immediately ask this vital question: is there a cure? And the answer to that really dictates the entire medical approach from that moment forward. The sobering reality is, no, there's currently no specific antiviral treatment or widely available vaccine for hantavirus. Because of that, modern medicine relies entirely on intensive supportive care. We can't directly kill the virus, so we just have to keep the patient's body functioning while their own immune system fights the battle. For HPS, this means intubation and oxygen therapy, or even hooking them up to an ECMO machine to completely bypass the failing heart and lungs. For HFRS, it means intense monitoring of fluid levels and potentially using dialysis to clean the blood if those kidneys start to fail.
Moving to Section 5, the global outbreak risk. Let's realistically assess the threat level.
We can actually find a lot of reassurance in the historical data. Despite how incredibly severe this disease is, actual infections are relatively uncommon. To put this into perspective, from the time they started keeping strict surveillance records back in 1993 all the way up to 2022, there were only 864 confirmed cases in the entire United States. Obviously, every single case is a tragedy, but on a population level, it remains a very rare occurrence.
Furthermore, infectious disease experts consider a massive, airborne global outbreak highly unlikely. Why? Well, because hantaviruses generally do not spread from person to person. You aren't going to catch it just by sitting next to someone coughing on a bus. Now, there is one notable exception to this rule. The Andes virus, which is found primarily in Argentina and Chile, has demonstrated some limited human-to-human transmission. But even then, it's usually only between household members or people in very close, prolonged contact.
Finally, Section 6, Prevention and Control. Let's talk about actually reducing your risk. So how does all this science translate into practical, everyday advice? Your absolute best defense, whether you're at home, at the workplace, or pitching a tent, is exclusion. Seal up those holes and gaps to prevent rodents from getting inside in the first place. Store your food securely so you don't roll out the welcome mat for them. And this is absolutely crucial. If you do find droppings, never ever dry sweep or vacuum them. That literally just throws the virus right up into the air you're breathing. Always wet down the contaminated area with a disinfectant first to trap that dust before you wipe it up.
And what about inside hospitals? Well, the evidence shows that the risk of healthcare-associated transmission is extremely low. As long as medical staff strictly adhere to standard infection control protocols, like thorough hand hygiene, safe fluid handling, and prompt isolation of suspected cases, they are totally safe. If they're performing aerosol-generating procedures, like intubating a patient, they simply scale up to airborne precautions. It's very manageable.
We're going to leave you with this final, thought-provoking question to take away from today's explainer. As climate change and deforestation actively push rodent populations into brand new habitats, bringing these viral reservoirs closer and closer to human populations with zero prior exposure, how will our interaction with the environment alter the risk of the next viral shift? While hantavirus might not be the next COVID-19, it's a stark reminder that our environmental choices today are going to directly dictate the state of our future health. Thanks for joining us for this deep dive, and we'll catch you next time.